Have you ever felt like your body's trying to tell you something, but you just can't crack the code? Maybe it's bone-deep exhaustion that sleep can't fix, a rebellious tongue that's sore and swollen, or a mind so foggy it feels like you're losing yourself. These aren't just quirks, they could be your body screaming for vitamin B12, a nutrient so vital it powers your energy, brain, and even your DNA. For seniors, especially, ignoring these signs could mean mistaking a fixable problem for the wear of time. Stick with us until the end because we're revealing 7 bizarre, often overlooked signs of B12 deficiency that could change how you feel, think, and live. By the final sign, you'll know exactly what to watch for and how to take action to reclaim your spark. Don't miss the one symptom that could save your heart or your mind. Before we begin, I would appreciate it if you like this video, you can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. 1. Bone-deep exhaustion that sleep can't fix. Imagine waking up after what should have been a restorative 8-hour sleep, yet your body feels like it's been dragged through a marathon. Rolling out of bed is a Herculean task, as if gravity itself is conspiring against you. Your limbs are heavy, like they're weighed down by invisible anchors, and your mind is shrouded in a fog that no amount of coffee can pierce. You yawn through meetings, struggle to focus on simple tasks, and find yourself daydreaming about napping by noon. This isn't just feeling tired or the normal ebb and flow of energy. It's a profound, bone-deep exhaustion that lingers like an unwelcome guest, no matter how much you rest. This relentless fatigue could be your body sounding the alarm for a deficiency in vitamin B12, a nutrient that plays a starring role in keeping you energized. B12 is essential for producing red blood cells, which act like tiny delivery trucks, ferrying oxygen from your lungs to every muscle, organ, and tissue in your body. Without adequate B12, your red blood cell production falters, leading to fewer, weaker cells that can't deliver oxygen efficiently. The result? Your body is essentially running on fumes, like a car with a clogged fuel line sputtering along. Muscles ache, your brain feels starved for clarity, and even simple tasks, like climbing a flight of stairs or answering an email, feel monumental. This kind of exhaustion is often misattributed to stress, overwork, or just getting older, especially for seniors who may accept fatigue as an inevitable part of aging. But dismissing it could mean missing a fixable problem. Low B12 levels are surprisingly common, particularly in older adults, whose bodies may struggle to absorb the nutrient from food due to declining stomach acid production. Vegetarians, vegans, and those with conditions like pernicious anemia or gastrointestinal disorders, e.g., Crohn's disease or celiac disease, are also at higher risk. If you're caught in a cycle of exhaustion that sleep can't break, it's time to talk to your doctor about testing your B12 levels. A simple blood test can reveal the truth, and supplementation, whether through injections, oral supplements, or dietary changes, could be the key to reclaiming the vibrant energy you thought was gone for good. Don't let fatigue steal your days. Listen to your body and act. 2. Mood swings that steal your joy. Picture this. You're sailing through a perfectly ordinary day when, out of nowhere, a wave of irritability crashes over you. You snap at a loved one over something trivial, like a misplaced coffee mug, and immediately regret it. Or maybe you're hit with a sudden, inexplicable sadness, a heavy fog that settles over your mind, making even your favorite activities feel joyless. One moment you're anxious, your thoughts racing like a runaway train. The next, you're inexplicably calm, only to swing back to frustration. These emotional roller coasters are exhausting, and while it's tempting to chalk them up to life stresses, a demanding job, family pressures, or the state of the world, low vitamin B12 could be the hidden puppet master pulling the strings. B12 is a critical player in your brain's chemistry, acting as a cofactor in the production of serotonin, dopamine, and other neurotransmitters that regulate mood and emotional stability. Serotonin, often called the feel-good chemical, helps you stay calm, focused, and content. When B12 levels dip, serotonin production takes a hit, leaving your brain struggling to maintain emotional balance. The result can be mood swings that feel like they come out of nowhere, irritability that flares up without warning, anxiety that grips you for no clear reason, or a persistent sense of sadness that mimics depression. In severe cases, B12 deficiency has even been linked to clinical depression and cognitive decline, particularly in older adults, who may mistake these symptoms for age-related changes or dementia. What makes this symptom so insidious is how easy it is to misinterpret. You might blame yourself, thinking you're overreacting or not handling stress well, when in reality, your brain is crying out for a nutrient it desperately needs. This is especially true for those at risk of B12 deficiency, such as vegans, who avoid animal-based B12 sources like meat, eggs, and dairy, older adults, whose absorption declines with age, or individuals with conditions that impair nutrient absorption, like gastritis or autoimmune disorders. If you've noticed your emotions feel unpredictable or your joy feels dimmed, don't just push through or assume it's all in your head. Ask your healthcare provider to check your B12 levels. Correcting a deficiency with supplements or dietary adjustments, such as incorporating fortified foods or B12-rich options like salmon, eggs, or nutritional yeast, could help stabilize your mood and bring back the emotional equilibrium you've been missing. Your joy is worth fighting for. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 3. Pale or yellowish skin that whispers trouble. Stand in front of a mirror and take a close look at your reflection. Does your skin look unusually pale, as if the color has been drained from your cheeks, leaving you with a ghostly complexion? Or perhaps there's a subtle yellowish tint, an odd hue that makes you look faintly jaundiced, like you've spent too long under fluorescent lights? These changes might be so gradual that you've barely noticed them, or you've brushed them off as signs of fatigue, stress, or even a bad night's sleep. But these skin changes aren't just cosmetic quirks. They're your body's way of waving a red flag, signaling that a vitamin B12 deficiency could be brewing beneath the surface. B12 is vital for producing healthy red blood cells, which give your skin its rosy, vibrant glow by carrying oxygen to tissues and flushing out waste. When B12 levels are low, your body churns out fewer red blood cells, and the ones it does produce are often oversized, fragile, and prone to breaking down prematurely, a condition called megaloblastic anemia. This breakdown releases a pigment called bilirubin, which accumulates in your blood and tissues, casting that telltale yellowish hue across your skin and sometimes even the whites of your eyes. This jaundice-like appearance can be mistaken for liver problems or other serious conditions, but it's often a direct result of B12 deficiency. Meanwhile, the reduced oxygen delivery from fewer healthy red blood cells leaves your skin looking pale, sallow, or washed out, robbing you of the healthy complexion you're used to. For seniors, these changes can be particularly easy to overlook. A pale or yellowish complexion might be dismissed as looking tired, or just part of aging, especially when the shift happens slowly over months or years. But ignoring these signs could mean missing a chance to address a deficiency that's not only affecting your appearance but also your overall health. B12 deficiency is more common in older adults due to reduced stomach acid, which is needed to absorb B12 from food, as well as in those with dietary restrictions or medical conditions like pernicious anemia, where the body attacks the cells that help absorb B12. If your skin is sending these subtle signals, don't ignore them. A quick blood test can confirm whether low B12 is the culprit, and treatment, whether through supplements, injections, or dietary changes, can help restore your body's red blood cell production and bring back the vibrant, healthy glow you deserve. Your skin is telling a story. Listen to it and take action to shine again. 4. A rebellious tongue and mouth in distress. Your tongue is more than just a muscle for tasting and talking. It's a surprisingly sensitive indicator of your body's nutritional health. When a vitamin B12 deficiency takes hold, one of the earliest and most striking signs can appear in the form of glossitis, a condition where the tongue becomes inflamed, swollen, and painfully red. Imagine waking up to a tongue that feels unnaturally tender, looks glossy or polished, and makes even the simplest tasks, like sipping a hot cup of tea, chewing a piece of toast, or articulating words during a conversation, feel like an ordeal. The discomfort can range from a mild, nagging soreness to a persistent burning or stinging sensation that lingers throughout the day. In severe cases, the tongue's surface undergoes a dramatic transformation. The tiny papillae, those small, bumpy projections that house taste buds and give the tongue its textured appearance, begin to flatten. This leaves the tongue looking eerily smooth and shiny, a visual hallmark of glossitis that can be alarming to see in the mirror. But the oral troubles don't stop at the tongue. A B12 deficiency can also trigger the formation of painful mouth ulcers, commonly known as canker sores. These small, shallow lesions can erupt on the inner linings of the cheeks, gums, lips, or under the tongue, turning every bite of food or sip of an acidic drink, think orange juice or tomato soup, into a wince-inducing battle. Unlike cold sores, which are caused by the herpes simplex virus and appear externally. Canker sores are non-contagious and tied to internal factors like nutritional deficiencies or stress. In the case of B12 deficiency, these ulcers arise because the vitamin is essential for the rapid cell turnover and repair of the mouth's mucosal tissues. Without adequate B12, these delicate linings become thin, fragile, and prone to irritation, making them vulnerable to painful sores that are slow to heal. For seniors, these oral symptoms can be particularly disruptive. Aging often brings challenges like dentures, dry mouth, xerostomia, or dietary restrictions that already make eating less enjoyable or uncomfortable. A sore, swollen tongue or recurring ulcers can exacerbate these issues, potentially leading to reduced food intake and further nutritional deficiencies. For example, someone avoiding solid foods due to pain might miss out on other essential nutrients, creating a vicious cycle. Additionally, glossitis can alter taste perception, making favorite foods taste bland or metallic, which can dampen appetite and quality of life. The science behind these symptoms lies in B12's critical role in DNA synthesis and cell division. The mucosal tissues of the mouth are among the body's fastest replicating cells, constantly regenerating to withstand the wear and tear of chewing, swallowing, and exposure to hot, cold, or acidic substances. B12 is a coenzyme in the production of DNA, the blueprint for new cells. When B12 is scarce, cell division slows, leading to abnormal tissue growth and inflammation in the tongue and mouth. The good news? These symptoms are often reversible with timely intervention. Increasing B12 intake through supplements, oral or injectable, fortified foods like cereals or plant-based milks, or dietary sources such as eggs, fish, or meat for non-vegetarians, can restore healthy tissue function. For seniors with absorption issues, common due to age-related declines in stomach acid or intrinsic factor, a protein needed to absorb B12, injections or high-dose oral supplements may be necessary. If your tongue is swollen, red, or glossy, or if mouth ulcers are making meals a misery, don't brush it off as a minor annoyance. These are your body's distress signals, and a simple blood test to measure B12 levels, along with related markers like homocysteine or methylmalonic acid, can confirm a deficiency. Early action can spare you prolonged discomfort and prevent more serious complications down the road. Consult a healthcare provider to discuss testing and treatment options, and consider keeping a symptom diary to track the frequency and severity of your oral issues, which can help guide diagnosis. 5. Tingling limbs that feel like electric shocks. Few sensations are as unsettling as the sudden onset of tingling, numbness, or burning in your hands, feet, or legs. Often described as pins and needles or tiny electric shocks, these symptoms can strike unexpectedly, leaving you rubbing your limbs in hopes of shaking off the discomfort. While occasional tingling might result from sitting in an awkward position, persistent or recurring sensations could signal a deeper issue: nerve damage caused by a vitamin B12 deficiency. B12 is a cornerstone of nervous system health, serving as a key player in the production and maintenance of the myelin sheath, a fatty, protective coating that surrounds nerve fibers. Think of myelin as the insulation on an electrical wire. It ensures that nerve signals travel quickly and efficiently from your brain to the rest of your body. When B12 levels plummet, the myelin sheath begins to degrade, disrupting these signals. The result? Strange, uncomfortable sensations known as peripheral neuropathy. You might feel tingling or burning in your extremities, a creeping numbness that makes your fingers or toes feel asleep, or even sharp, shooting pains that come and go. For seniors, these symptoms can be especially concerning. Peripheral neuropathy not only causes discomfort but can also impair balance and coordination, increasing the risk of falls, a major health hazard for older adults. Simple tasks like buttoning a shirt, gripping a utensil, or walking on uneven surfaces can become challenging or even dangerous. In severe cases, untreated B12 deficiency can lead to irreversible nerve damage, making early detection critical. If you're experiencing persistent tingling, numbness, or electric shock-like sensations, don't dismiss them as a quirk of aging. A B12 deficiency could be the culprit, and addressing it with supplements, injections, or dietary adjustments could help protect your nerves and restore normal sensation. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 6. A racing heart that feels out of control. Your heart is supposed to beat steadily, reliably, like a metronome keeping the rhythm of your life. So when it suddenly starts to flutter, pound, or race for no apparent reason, it's natural to feel alarmed. These heart palpitations, sensations of a skipping, racing, or irregular heartbeat, can mimic the symptoms of a panic attack or even a cardiac event, sending you into a spiral of worry. Surprisingly, one possible cause isn't your heart itself, but a deficiency in vitamin B12. Low B12 levels can trigger a condition called megaloblastic anemia, where the body struggles to produce enough healthy, oxygen-carrying red blood cells. Instead, it churns out oversized, poorly functioning cells that can't deliver oxygen efficiently to your tissues and organs. To compensate, your heart kicks into overdrive, pumping harder and faster to circulate what little oxygen is available. This extra effort can manifest as palpitations, shortness of breath, dizziness, or overwhelming fatigue. Over time, the constant strain on your heart muscle can weaken it, increasing the risk of long-term cardiovascular issues. For seniors, heart health is a top priority, and palpitations caused by B12 deficiency are a warning sign that shouldn't be ignored. The symptoms can be subtle at first, perhaps a fleeting sensation of your heart skipping a beat, or a moment of lightheadedness when you stand up. But as the deficiency worsens, these episodes may become more frequent or intense, accompanied by weakness or a pale complexion. The good news is that megaloblastic anemia caused by B12 deficiency is treatable, often with supplements or dietary changes that restore normal red blood cell production. If your heart feels out of control, a simple blood test can reveal whether B12 is the missing piece of the puzzle. Addressing it promptly could steady your heartbeat and protect your cardiovascular health for years to come. 7. Forgetfulness that feels like losing yourself. Memory is the thread that weaves together your sense of self, connecting past experiences to present moments. So when that thread starts to fray, when you forget where you parked your car, struggle to recall a friend's name, or lose your train of thought mid-sentence, it can feel like you're losing a piece of yourself. For seniors, these senior moments often carry a heavy emotional weight, raising fears of cognitive decline or dementia. But what if the culprit isn't an inevitable part of aging but a treatable nutritional deficiency? Low vitamin B12 can cloud your mind, causing brain fog, memory lapses, and even symptoms that mimic serious neurological conditions, offering hope that clarity may be within reach. B12 is a powerhouse for brain health, supporting multiple processes that keep your mind sharp. First, it helps maintain the myelin sheath, the protective coating around neurons, nerve cells, that ensures rapid, accurate communication across the brain's vast network. This is critical for processing information, forming memories, and retrieving them when needed. Second, B12 is involved in the production of neurotransmitters, the chemical messengers that regulate mood, attention, and cognitive function. For example, it supports the synthesis of serotonin and dopamine, which influence everything from emotional stability to mental focus. Third, B12 helps regulate homocysteine, an amino acid that, when elevated due to B12 deficiency, can damage blood vessels in the brain, increasing the risk of cognitive impairment and even stroke. When B12 levels dwindle, these processes falter, leading to a spectrum of cognitive symptoms. You might notice difficulty concentrating, as if your thoughts are wading through molasses. Brain fog, a vague, fuzzy feeling that makes even simple decisions feel overwhelming, can set in. Memory lapses, particularly for recent events, may become more frequent, while older memories remain intact. In severe cases, B12 deficiency can cause confusion, disorientation, or personality changes, such as irritability or apathy, that mimic early dementia or depression. This overlap is particularly concerning for seniors, as it can lead to misdiagnosis and delayed treatment. Studies suggest that up to 15% of older adults with cognitive symptoms may have an underlying B12 deficiency, making it a critical factor to rule out. For seniors, the emotional toll of cognitive changes can be profound. Forgetting a grandchild's birthday or struggling to follow a conversation can erode confidence, leading to social withdrawal or anxiety. These changes can also strain relationships, as loved ones may misinterpret confusion as disinterest or stubbornness. The fear of losing independence, whether it's the ability to manage finances, drive, or live alone, can loom large, making it all the more urgent to identify reversible causes. The good news is that B12 deficiency is one of the few causes of cognitive impairment that can be treated, often with dramatic results. Supplementation, typically starting with injections or high-dose oral B12, can replenish stores and begin repairing neurological damage. Improvements in memory, focus, and mood may be noticeable within weeks, though recovery depends on how long the deficiency has persisted and the extent of any nerve damage. Dietary changes, such as incorporating B12-rich foods or fortified products, can help maintain levels, but seniors with absorption issues, e.g., due to pernicious anemia, gastritis, or medications like proton pump inhibitors, may require lifelong supplementation. If you or a loved one is grappling with unexplained forgetfulness, difficulty concentrating, or other cognitive changes, don't assume it's just a natural part of aging. Keep a detailed record of symptoms, including when they started, how often they occur, and any accompanying issues, e.g., fatigue, tingling, or mood changes. Share this with a healthcare provider and request a blood test to measure B12 levels, along with related markers like homocysteine or methylmalonic acid. In some cases, a folate test may also be recommended, as folate and B12 deficiencies can produce similar symptoms. Early intervention could lift the fog, restore your mental edge, and help you reclaim the sharp, vibrant mind you've always relied on. Wow, we've just uncovered 7 bizarre signs that your body might be crying out for more vitamin B12, from bone-deep exhaustion and a rebellious tongue to tingling limbs and a foggy mind that feels like it's slipping away. These aren't just symptoms. They're your body's urgent SOS, and now you have the power to listen and act. So, what have you learned today? Maybe it's recognizing that your unexplained fatigue isn't just aging, or that those strange tingling sensations in your hands could be a wake-up call. We want to hear from you. Drop a comment below and share one thing you've learned from this video that you'll put into practice. Whether it's talking to your doctor about a B12 test or adding more B12-rich foods to your diet. Your story could inspire someone else. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more life-changing health insights. Let's keep the conversation going and help each other thrive.